Okay, so for everyone who just joined, this meeting is being recorded at the speaker's request. So I'll just go ahead and get started. So this is thank you, Dr. Raman Khanna, MD, MAS, for joining us today. He's an associate professor of clinical medicine at UCSF, a member of Hindu American Foundation's National Leadership Council, and a teacher at his local Chinmay Mission Bal Vihar, which is a Hinduism Sunday school.
I just wanted to sort of like reiterate, like the point of our event today, sort of like some of the things that that Dr. Khanna will be talking about. Just a little bit about like the cultural practices that are seen in Hinduism and how this could translate over to the patient-doctor relationship, in the future with us as future physicians. Um, so I just wanted to emphasize that in taking the time to learn and try to understand more about this kind of stuff, more about different groups of people, it ultimately will affect our role as future physicians. And I think that one of the most important skills to develop and carry with us as future physicians is cultural competency and cultural awareness. And like the ability to effectively communicate with our future patients, who could come from like all, different various backgrounds. So we're having an event like this sort of to, like serve that purpose and help us fill in that gap and, just learn more about different groups of people. And I won't go off on a tangent. Dr. Khanna, if you'd like to add anything.
No, that's great. I was just going to say, thanks so much, Noor and Anushri and whoever else was part of like sort of reaching out to Hindu Speakers Bureau and to the Central Michigan University College of Medicine Diversity Committee. I'm really excited to talk to you about the topics that you sort of charged me with. And so I was just going to go ahead and get started. And so I'll be going through like these three topics and I'll try to intersperse the impact on you as a physician throughout because I think it'll hopefully make for a more engaging and interesting talk than to cover it all at the end, although there will be some of that. So I'll talk about Hinduism basics, I'll talk about Hinduism in America, and I'll talk about the Hindu patient as you might encounter them and some of the specific things that you might see. And before I start, I just should be really clear about my own perspective on this topic. I am not a Hindu priest. I'm not a Hindu monk. Those are sort of like the two people that in general, like Hindus would go to with questions about like, life, death, disease, like why is this happening to me? Like all the sorts of questions that people tend to have when they're in disease or spiritual crisis. But I am a second generation American, as I'm guessing many of you are. I am the child of immigrants. Even though I'm not an immigrant myself, I speak Hindi, which is one of the many languages of India. And I should just note that Hindi and Hindu are different. Many people sometimes will say, "Do you speak Hindu?" Say, I am Hindu, but I speak Hindi, and Hindi is not the only language that's spoken by Hindus either. So I, as somebody who's also a religious Hindu, I teach at my local Balvihar, which is like what we call Sunday school. It's a chance for me to really like sort of engage with youngsters who are typically in the ninth grade. So significantly younger than you, although not, you know, they're closer in age to you than I am to them, than I am to you, I guess, at this point. And I've just always had a really strong interest in religion and philosophy. And so I've maintained that interest, reading in this space, thinking about this space, engaging a little bit in interfaith where I had time. And then, other than that, I should also, of course, note that I'm a physician, like many or all of you will eventually be. And since internal medicine residency, I've been a hospitalist, so I basically administrate to inpatients, and that's been true for the last 13 years. And like many of you, my beliefs and commitments inspire the way that I practice medicine. And like many of you, I bring those beliefs and commitments into my interactions with my patients as well. All right, so with that covered, let's go ahead and talk a little bit about Hinduism basics. And Hinduism is a really, really big topic. And in advance, I just want to say that many of the people on this call may also be Hindu. They may agree with some of it, they may disagree with some of it. That's why I thought it was very important to sort of situate this. I won't assume that you've all had a long exposure, and I'm going to use a mix of quotes, high-level summaries, and stories to sort of walk through it. And I'm just going to start with this prayer, which I'm just going to very briefly say the way we would say it. It's not anything like sort of, hopefully it's not controversial. I don't think it would be controversial, but it goes like this. ॐ त्र्यम्बकं यजामहे सुगन्धिं पुष्टिवर्धनम् उर्वारुकमिव बन्धनान् मृत्योर्मुक्षीयमामृतात् So this is called the Mahamrityunjaya mantra. It's like a prayer that the translation of it is as follows. It's very highly symbolic, as a lot of our prayers are. And so it's describing that, like a cucumber, um, I want to be freed from the root that is death and not freed from deathlessness. So I want to be freed from death. And so this is actually a prayer a lot of Hindus will say when they're sick or when a loved one is sick. And there's some symbolic significance to saying it 108 times or 108 times, 108 times. And so all of that can happen. And it actually occurs in one of the oldest parts of one of the oldest religious texts that exists, the Rig Veda. And it actually got additional support from a story, and this is one of the stories. So the story here is that there was a sage family that prayed to have children, and they were essentially given a choice. And you might recognize this choice as a time trade-off. How many of you have heard of a time trade-off? You can react or you can raise your hands. It's one of those things in public health where they'll talk about. Where do you want to be in a perfect state of health for 5 years or in your current state of health for 10 years? And then they kind of ask that question over and over. What about 6 years? What about 7 years? Essentially, how much is perfect health worth to you compared to your current health state? Some people who are really, really sick might say, I'd rather have 1 year of perfect health than 10 years at my current state, for example. And so that, I remember when I heard that in medical school, it reminded me of this particular story of this boy named Markandeya. And Markandeya was a boy who, when they were given a choice as parents, they said that you can either have a child who's sort of average and grows up to be 100, or you can have a child who really shines, who is a brilliant scholar. And, I'll return again and again to this idea of scholarship, education, and sort of like the value for learning, which I think are sort of through lines for a lot of Hindus or for a lot of Hinduism. And so when the parents were given this choice, that child would only live to 16. Or they could have a child who lived to 100 who was average. And so they chose the child who would be a brilliant scholar but would die at 16. And so indeed he was born, he was a brilliant scholar. He actually was like very well respected and really shone. But when he turned 15, his parents started to cry, and they were crying and crying and crying. And so he went to them and asked them like what that was all about, and they explained the sort of deal that they had made. And so he said, "Don't worry, I'll go and I will pray to Lord Shiva." Lord Shiva is sort of like one of the gods in Hinduism, and he said, he's sort of the dissolver. Sometimes he's referred to as the destroyer, which is sort of incorrect, but he's also the universal meditator, and he's the most tranquil of all the beings. And they asked his permission, his protection rather. And when they did that, on his 16th birthday, Markandeya was in prayer, and the Lord of Death arrived. And you can see him here on the bullock. And as he arrived, he started to throw his noose on Markandeya, who you can see here. But Lord Shiva appeared and essentially said, "This boy is under my protection," and drove death away. And when he drove death away, he sort of explained this mantra to Markandeya, and Markandeya basically cheated death. And so this is a story, this is a prayer that is very, very common. It's not common to all Hindus, but it is common to many, or even say most of them. So with that framing, let's go ahead and start at the highest possible level of Hinduism, which is what is the purpose of life? And the purpose of life is divided into 4 different parts according to Hindus. They're called the Purusharthas, or like the meaning or the purpose. And these are really well defined in the following way. The first is pleasure. That's one of the purposes of life, Kama. Now, many of you may have heard of Kama, you may have heard of the Kama Sutra, and I just want to really emphasize that that is not the only kind of pleasure that we're talking about. This is all kinds of pleasure. Eating ice cream, doing anything like that is all considered the same. The second is artha, or wealth. And arth is actually interesting because wealth by itself really doesn't give you much, but you can trade it for pleasure later. You can trade it for happiness later. And so that's one of the ideas, is that there's a natural tension between those two, which you all know, right? Like you can either go you can go out partying or you can study for your medical school exam. Partying will pay off now, but going and studying may pay off on the test, we hope. And so that's the kind of trade-off that's sort of obviously known to everyone. Then there's this idea of duty and righteousness, or dharma. And this is where if you do the right things, Of course, they build good relationships, they're really valuable, but there's an additional component in Hinduism, this idea of karma. So the way you obtain good karma is by doing your dharma, by doing your duties. And when you do them right, then you will maximize the good and reduce the bad. And that will carry over not just into the future, but into the next life. So that's when I say there's a distinction between artha and dharma, which is that the right thing sometimes is right way, way out there. And then finally, there's liberation or moksha, which is happiness eternal. And so all of these together are considered important goals. And you can imagine that the hierarchy is that the last one is the most important, the second to last one is the second most important, but all of them are important in their own place. And so for Hindu patients, when you encounter Hindu patients, they may talk about liberation, they may talk about moksha, they may talk a little bit about righteousness as well, but we're all taught to sort of inquire about our patients, like what are their values, right? Like what do you envision as the ideal outcome of this hospitalization? You know, you have this particular disease. In some cases, it will be a really horrible disease. What is it that you value the most as we think about how to treat it? So I would say that that is one way of thinking about when you approach a patient who is Hindu or who is, I guess I would say, consciously or actively Hindu. You know, there's obviously like a huge distribution, which is one of the things I'll get into. Karma and reincarnation. So here, the thing I want to say is that all actions have consequences. Those consequences are physical, they're emotional, they're intellectual, they're also moral. And so the action that can bear fruit right away is an obvious one, right? Like if someone, yeah, you know, you see like someone who's in like a trauma, right? Like someone there's a gunshot wound in the ER. So that's an obvious case where somebody did something and someone got hurt. But the moral action that was committed, that act of violence, can bear fruit right away. They get arrested, go to jail, or it can bear fruit much, much later, even in a future lifetime. So you can never really outrun the law. You can outrun the physical law, but you can't outrun the moral law. And you will pay the consequences of all of this. And so I think that, you know, one of the things to note about this is that people will try to adhere to their what they perceive to be their duty. And everyone's duty is a little bit different. And it's framed by your relationships. Like I'm a daughter, I'm a son, I'm a father, I'm a mother, I'm a you know, brother, sister, etc. Also, I'm a citizen. Also, I'm a doctor. So all of those have their own sort of duty that's incumbent upon them, right? And so one thing I'll note about this is that for one thing, Hindu patients may, in some cases, say, this was just my karma. Like, I am suffering the way I am. This is what was meant to be. And if a medicine can help take that away, that's also my karma. So it's not fatalism. I don't want you to think that it's fatalism, because that's definitely not the ideal, though it can manifest that way. But it's that idea that, you know, Christians might say, this is my cross to bear. Like, this is what was meant to be. And so you may notice that Hindu patients say this. I won't say that all of them say this, and that's one thing that I just want to add that as a universal caveat, that not all of this will apply to every patient, period. And Hindu patients may speak of the next life. They may or may not do it with you if they're not comfortable sharing their religious beliefs, but they may speak of, you know, like this is you know, this is like this is what happened to me because of something that happened in a past life, or this is something that in a future life I'll, you know, this is so that I can pay this off so that the next life will be better. Okay, so Hindu values. So the first thing I'll say is that every religion teaches moral values. And as somebody who studied religion in college, I find it very interesting to think about which ones are common and which ones are slightly different. And so some of the values, the ones in red, are going to be values that are pretty universal or recognizably universal. So Hinduism really emphasizes satyam, which is truth. And it's not just speaking the truth, although that's part of it, but seeking the truth, which I think will be familiar to many of you. If any of you are, is anyone here an MD, PhD? Anybody doing research over the summer or did research? So this idea of finding out what's true is really, really important. And in addition, there's a value for ahimsa, which is non-injury or non-violence, which I think is mostly universal, but maybe not like, it's not always the most important thing in every religion, but it's considered paramodharma, which is the most important value in Hinduism. And I really like that because I think it sort of accords with my self-perception as a physician, right? Like primum non nocere, first do no harm. And many of you would appreciate that as well. So this idea that we really want to limit the amount of injury that we're doing. And that's true in obviously interpersonal interactions. It's also true when you're deciding whether a surgery is appropriate, right? Only if it is better than the alternative. And the alternative may be like the current state of health may actually be fine, and it's fine not to do surgery in certain cases. Dhanam, this act of charity, again, very universal. Vairagya, which is detachment. This is an interesting one and slightly different. So Hindus will talk about detachment as one of the ways in which you can spiritually grow by not being too attached to the fruits of your action. It's absolutely fine to be focused on the action itself. Like I studied for this test, I did this surgery, I administered this medication, I did whatever I did. But at the end of it, the patient didn't survive, or I didn't get a good grade, or had a bad outcome. And that kind of thing happens all the time. And the best that you can do is adhere to the first three values. And once you have sort of let your action go, like once you've done the action, you have to have a certain amount of detachment. And that detachment will help you both learn from any mistakes you've made and address things, but also not get caught up in a cycle of negativity, which doesn't help anything. There's this concept of the sthita prajna. This is a person who's fixed in wisdom. So it's sort of an extension of vairagya in a way, which is that you do things without the expectation that you will be rewarded for them. And so you try, and when you get rewarded, that's great. When you get punished in some cases, that's just part of life. Like sometimes things work out and sometimes they don't. So you can think of it as stoicism in a way as well. And one thing I'll just say is that Hindus will sometimes refer to their religion as Sanatan Dharma. I don't think you'll hear that very often unless you are also Hindu and you're talking to a Hindu patient, but it's Sanatan Dharma means like the eternal duty, the eternal righteousness. And the idea is that these values are all eternal values. They may change in the way that they're applied in the moment, but they are not, they are themselves recognizably true, whether it was 5,000 years ago, 3,000 years ago, or today. Um, and then let's talk a little bit about the paths to liberation, because that's something that I think that is interesting and slightly different. So Hinduism recognizes over a period of time three basic paths to achieving enlightenment, achieving moksha, achieving liberation. The first is bhakti yoga, which is a path of devotion. That's prayer, purification through prayer. Um, and the next one is Jnana Yoga, which is the path of knowledge. And here the idea is intense scriptural study. So this may have something in common with other scriptural traditions, the Kabbalah or something like that. For those of you who are Jewish, those who study like in depth their scriptures and try to really understand what they mean. Many of you might be participating in this kind of thing if you're doing like a Bible study or a Quran study or something like that. And then Karma Yoga, which is the path of action. And here, I think this is like meant for the householder. In other words, anyone who is not doesn't have a full-time ability to devote themselves to this. So they can go and they can work on themselves from time to time by studying, by praying, and doing these kinds of things. But really, the way you achieve enlightenment, if you're a householder, someone who has worldly, secular obligations, is through this idea of detachment, this idea of doing your duty but not being attached to the results. Much easier said than done. And here there's this verse from the Bhagavad Gita. So the Bhagavad Gita is like one of the most important religious books in Hinduism. And it is interesting because this one verse is often considered the essence of the entire Bhagavad Gita. So if you know this one verse, you know the basic message of the Bhagavad Gita right there. And it is that you have the right to work only, but never to its fruits. Let not the fruits of action be your motive, but also don't become attached to inaction. So you can see it sort of simultaneously tells you that you should be taking action and not sort of um, acting like a Hamlet, right? Like Hamlet was very famous because he was considering on the one hand, on the other hand, on the one hand, on the other hand, and then he just didn't do anything and just things kept going wrong. And so the Bhagavad-Gita speaks to that in that way. And so one thing I'll say is that Hindu patients may be really familiar with this idea. And even like, when I've interacted with Hindu patients of my own, like sometimes I will say things like, oh, we have the right to work. And obviously only in the right context. And this is something that most of them will recognize because it's so sort of popular in the culture, so popular among us. Sacredness of all living things is important to Hindus. I would say that ahimsa parama dharma is like one of the basis of this, right? So we talked about non-injury being the highest form of righteousness. And so one of the ways in which this will manifest that can be very obvious to you is that a lot of Hindus, and I don't want to say all Hindus, not even a majority, but a lot of Hindus are vegetarian. um, you will find that in addition to that, many of them will actually restrict specific meats, like they may not eat beef, they may not eat pork. And I would say it's probably fair to say that most Hindus you encounter will not eat beef. They may eat all of the other meats, but beef in general is something they won't. And there's a variety of reasons for that. Some of them are cultural, some of them are religious. Here you can see a picture of Lord Krishna, who's one of the avatars, one of the sort of human manifestations of the divine spark. And he was very, very famous as a cowherd. And I think that at least partially his influence, or his historical influence, is that people sort of see the cow as associated with him. And as a result, there's a lot of pushback on eating beef, a lot of pushback on slaughtering cows. And you may also see some resistance to intervention in specific cases. And again, I absolutely do not want to generalize. It is impossible to generalize to any religious group. It is definitely impossible to generalize to Hindus about like what you will actually notice. Some may say, all of the interventions you have to give, please give them to me. But what I've noticed and what may be possible to see is that in some cases, very invasive interventions are not desirable. And it's because the extension of life is not the only goal, or it's not, and it may be the most important goal, but it's not considered the only goal. And so people may say, like, my body has had enough. I don't need this. I don't want this. And again, it'll be very, very variable, and I don't want to generalize. Yoga and meditation. How many of you do yoga or know about yoga? All right, so some hands. I would say that yoga and meditation is the kind of thing where many people practice it, whether they're Hindu or not. Hindus see it not just as a pathway to physical health, but also to spiritual health. It's part of like a system of practice where through controlling your likes and dislikes, controlling the things you should and shouldn't be doing, controlling your body, that's asana, which is one of the limbs of yoga. People think of it as yoga, but it's actually only one of 8 parts of yoga. And controlling your breath, pranayam, and meditating, all of those are supposed to help situate you along one of those other 3 paths I talked about on the road to enlightenment. And it helps to tune the mind, cultivate detachment, etc. There's ongoing research regarding the health benefit, which I'm sure you may encounter if you take classes on complementary and alternative medicine. I would say that there's some question about maybe it's helpful for depression in some cases. But I will just note, taking off my hat as a Hindu and putting on my hat as a physician, especially one who works at an academic medical center, you can imagine this is a very tough thing to study. Um, I have seen people who have designed trials around yoga for the NIH, and it's really interesting because the NIH wants to make sure that the benefit is not just from exercise. So you have to randomize people to doing exercise versus yoga, not like placebo versus yoga. And what is placebo exercise? I mean, all exercise has some benefit, right? So it's like, well, they do stretches, but a lot of yoga is stretching. So what's the difference? They said, well, we will leave out body inversions, right? So like the headstands, the handstands, the things that people do. But it's like that when you think about how fine a hair you're splitting, like it's really, really hard to do it in a way that shows that really it's the yoga that's beneficial versus the exercise, or that anything is beneficial. But with that said, people have tried, and there has been some evidence that it helps in depression. But this is really, really important, and this is something that I say to Hindu patients and to patients from other traditions as well, which is that everything that can have benefit must also be able to cause some harm. So it's just not the case, right? You all have learned about pharmacodynamics and pharmacokinetics. Is that something I should have asked? Like, is this a crowd mostly of first-year medical students, second-year medical students? Is there like a good mix?
You've got a mix of M1s and M2s here, and some
M1s and
also.
M2s. Okay, and is the idea of pharmacodynamics, is that something that you've studied where there's like a effective dose and a lethal dose for
Yep,
50% of people?
especially the
So,
M1s. We all get that
yep.
in our
Oh, you
first.
all do. Okay, good, good. So you've all heard this. And so, any medicine that has absolutely no lethal dose probably doesn't have an effective dose either, right? Like it just doesn't do much. And I think the same thing is true of yoga, which is that it's, some of the postures are very intense and they're not for everyone. And like I had a firsthand introduction to this, unfortunately, with my own personal health issue. I had a slip disc a couple years ago. Nothing too severe compared to what people go through in general, but I saw the neurosurgeon, and he was very, very like clear. He's like, if you want this slip disc to resolve, no bending, lifting, twisting, no BLT, he said. I said, okay, no BLT. Well, what about yoga? And he said, absolutely no yoga for the next 6 months. And his point was that, there's a lot of twisting in yoga, there's a lot of inversion. He's like, I don't want you to load your axial spine at all if you can avoid it, because you don't want the disc to slip more. And so I laid off of it. And now I've gone back to it, but it's just the kind of thing where you just really want to be very careful, especially because, like many things, patients will do things without telling you, right? And so you may consider asking about it. I don't think it's racist to ask if you see someone who you know is Hindu or you think might be Hindu, or even not Hindu, like, do you do any yoga or exercise? And if they say, oh yes, I do yoga, then you can say, that's fine. I would suggest that because you have a slip disc, that you really consider not doing these kinds of postures, at least for the next, few months or whatever. And of course, you'll get that specific knowledge when you are at that stage of training as well. And just everything is a negotiation, right? Like, okay, fine, you can do these postures, but don't do these postures if you get pushback. So that's just a good skill in general. Ayurveda is traditional Indian medicine, traditional Hindu medicine. It comes from the Vedas, as you see from the name. I think that, you'll see, like you see turmeric here, you'll see there's a lot of ashwagandha, all these different compounds that people will often take. They may take it without telling you. So very important to ask, like, what other things do you take? I'm sure many of you learn this in your social medicine classes, right? Like how to interview patients about like what they're taking and what they're not taking. And so, a lot of these people will take them, and, I think the standard line that many of us have adopted is, okay, if you feel like it's helping you, just let me know what's in it, or if you can bring in what's in it. And sometimes we can search and do a PubMed search, so you don't end up with something like the classic association, right? St. John's wort. Many of you have heard about St. John's wort for depression. It's like, it's probably still being taught. I have no idea who still takes it, but I'm sure there's some people who still take St. John's wort. But it interacts with some blood thinners. It interacts with so that can be a problem, right? And so that's one thing. The other thing I'll say is that sometimes traditional medicines, they actually can be really, really dangerous. That's true of Ayurveda, just like it is with everything else. And so you just want to make sure that they're getting it from a reputable dealer, that they're not like, and that they're aware of some of the potential risks. I remember I was really shocked when I saw this study in 2008. This is like tail end of residency for me, but lead, mercury, and arsenic were all found in like 20% of the Ayurvedic medicines that were being administered. And there's some thought that that didn't have anything to do with how they were processed. It just had to do with the soil that they were grown in. because a lot of them come from the same like parts of India, and it just happened to be contaminated with lead. Well, if it's contaminated with lead, it's contaminated with lead, and you definitely don't want that. And so it's worth being aware of these kinds of things. You know, there's certain like Chinese herbals that have been associated with liver failure. The same thing is true of Ayurveda. So it's just something to be aware of and to ask about. One other Hinduism basic is just a value for learning and knowledge. I think that that is something that you have probably noticed in general. If you have friends who are Hindu, they are, you know, especially in medical school, like obviously, like you have to be a little bit of a gunner, right, to get into medical school. And there's a very, very strong push from a lot of families to get their kids into, you know, the two allowable professions, right, engineering or medicine. That's sort of a joke, but it's not totally a joke, as many of the people on this call will recognize. And the one of the manifestations of that is exactly that kind of learning and focus on it. But there's also another interesting thing. How many of you, if you have Hindu friends, how many of you have noticed that they really get very antsy if you try if you have your feet near a book? I see Anushri nodding. And yeah, so I mean, this is one of the things that just is worth being aware of is that this is Saraswati. She's the goddess of knowledge and learning, and she is pictured here holding a musical instrument, a prayer bead, and a book. And so it's considered like sort of like dishonorable and like you're dishonoring knowledge if you put your feet on a book because you're supposed to learn from a book. And so I guess the main lesson here is if you're like, if a patient has like an orthopedic injury and you're trying to elevate their leg or something like that, please don't use a book. It's just one of those things that you should just not do with Hindu patients. Many of us have this, and many of us like we kind of notice it almost jokingly. Like if you see them like near a book and they like are touching it with their hand and then they touch it to their head, that often means that they're sort of like apologizing for having stepped on it. Okay, so now on to some misconceptions. So I think you've heard me talk about, you know, Lord Krishna, Shiva, the goddess of knowledge, and you might think that it's very obvious that therefore Hinduism is polytheistic. But that's actually not a super useful distinction in Hinduism. What I mean by that is in Hinduism, there's considered to be two different aspects to the divine, or what we call Brahman. And that divine has a component that is with attributes, sagun, and one that is without attributes, nirgun. And they're considered parts of the same thing. So all of the different divinities that Hindus worship, they tend to identify them at the base level with the ultimate divinity. And there's not like a fight between them or anything like that. And so you know, it's sort of described sometimes that divinity as colorless, shapeless, without texture, subtle beyond what words can cut. So that idea that words can't cut it, words can't get into the spaces between what is like what is uh, what is said and what is unsaid. And so anyway, I'm gonna go ahead and skip ahead because I think that I've kind of made this point. But God is worshipped in many, many forms. One is this sort of Vishvarup form, which is like you know, this number of arms is supposed to signify an infinite number of arms, like an all-powerful being. This number of heads is supposed to signify an infinite number of heads, all-knowing divine, and so on and so forth. And here, that same God is picturized as like a baby. And from one of our religious texts, one of my favorite stories is actually that this particular God was basically going to be born into a human mother, and you know he came to her before the moment of his birth to sort of describe like what his life would be like, and his mother was just like totally amazed and sort of like shocked that she was going to be able to bring up a child like that. You'll notice some overlap with the story of Mary Magdalene, or Mary, Mother of God, right? And so, for those of you who are Christian, and so one of the things he says is like, "What can I do next?" And she says, "I beg you, don't come in this form. Come as a baby so that I can love you like you're a baby and love you like you're like a little boy and love you like you're a man as you get older and not have to constantly be thinking of you as the Lord." And so he took that advice and immediately, like as soon as he was born, he began to cry. and she forgot all about the fact that he was God, and it was reminded from time to time about that. So anyway, but the end result is that Hindu patients, when you encounter them, will often adopt mono language. Like they'll talk about God, they won't talk about the gods. And so just something to be aware of. Murti puja is something, if you hear like, oh, Hindus worship idols. And so I would say that the most accurate thing to say is that we worship God through the picture, through the image, through the idol, not directly worshiping the idol. And there's a lot of it is very symbolic. Like in India, if you're at a traditional shop where they sell these murtis, you'll notice that all of their eyes are closed. And this traditional sculptor will not actually sell you the murti until you've picked one out. And once you've picked one out, they chisel open the eyes right then and there. It's very symbolic that now there is a focus for your attention in meditation. It's as much for you as it is for the divine, because the divine doesn't need anything. So you may see murtis if you go and do like a home visit. Some people may bring them to their hospital bed. And so I would just say, like, if you see one, ask before moving it. But it's not. It's a misconception that people worship that actual um, stone or picture or whatever the case might be. And so I'm going to end the part about the basics with this idea that the world is one big family. There's a real strong emphasis on pluralism in Hinduism. You'll hear this quote said over and over: "The truth is one, but the wise call it many names. Ekam sat vipraha bahuda vadanti," which means that the truth is one, but the wise actually refer to it in many ways. And they really emphasize this idea that they want noble thoughts to come to us from all sides. And the practical impact of this is that Hindu patients may end up doing it all. I've noticed this, you may have noticed this with patients if you see them as well, but they'll take the Western medicine, they'll also take traditional Indian medicine, they'll also take some other medicine if they're told that it's a good idea. Hinduism tends to be very additive rather than substitutive. And so just to be aware that just because they start taking a medicine you've given them doesn't mean they'll stop taking something else unless you explicitly tell them why. Um, All right. So now I'm going to transition, but before I do, any questions so far? I haven't noticed any in the chat, which I've sort of peripherally been following. Okay, go ahead.
Hi. I just have a question because it was really interesting. You said additive.
Mhm.
So, do you see a lot of those within the Hindu population have drug-on-drug interactions since it's more of an additive approach or any toxicity-based things?
I think maybe more so in India for reasons that I'll get to in a minute. It is certainly possible, but it's not something like I specifically keep my eye out for. But when you're taking a history, it's important to ask about it. And for exactly the reason you just mentioned, which is that you definitely don't want drug-drug interactions. You want to know that the medicines that you're administering from the Western framework are going to work as expected. Great question. Any other questions? All right. So then I just want to say a little bit about Hinduism in America, just because this is the population that most of you will take care of. Some of you may be interested in global health, um, and so you may actually go to India, but I feel like if you're going to go to India, it's better for you to learn about it when you're in India, because there's so much diversity that anything I say will be wrong, or at least partially wrong. Um, but Hindus in America are a slightly more specific population, even though it's still very, very diverse. And so I would say they're 0.7% of the population. Some of this is taken from the Pew survey that was done recently. Some of it's taken from other aspects, which I'll sort of highlight as I go in case you're interested in reading about this. It's mostly a Gen X or millennial population, and I think that can be ascribed to the fact that for the majority, not for all, but for the vast majority of Hindus, they came here as a result of the sort of immigration reforms of 1965. And so that's when my parents came. That's probably when many of the people, I guess many of the people in this call, maybe their parents' came. But essentially that's the genesis. And the population is mostly South Asian immigrants, but not all. You will find Hindus, especially from, like, say, the International Society of Krishna Consciousness, which is the Hare Krishnas. Um, at certain places where you practice, you may have like specific populations, but In general, I would say like it tends to be among South Asian immigrants. And this is just a picture of a temple in America. So they've tried to preserve some of that, some of the structure of that. Hindus in America tend to be highly educated. Almost 77% are college plus, versus 33% for mainline Protestant, which when I see figures like that, it always is just like a surprise, and I have to sort of check my own assumptions about the world, right? We're around physicians, we're around nurses, we're around all sorts of like very highly educated professionals. But at the end of the day, only 33% of Americans that are, and this is like, I would say mainline Protestant is the most common denomination that Pew surveys, but this is very broadly similar to many others. And that's kind of like the figures that you'll see is that 33% of America has like a degree or an advanced degree. It's a relatively well-off population. I think a lot of that has to do with who has been allowed to immigrate into America. I think more people would if they could, but in general, America wants people who have advanced degrees. And since there's such a strong push, that those tend to get prioritized from India. There's some quota from each country, and since India is a big country, it tends to America will tend to take those who are doctors, those who are engineers, et cetera, et cetera. And so they tend to be well off. Again, it's very, very surprising if you look at it that when we say well off, we mean 70% make 50K or more. That's well above the median, which I think is very surprising to people that are in medical school or who are physicians sometimes, that that's the median income for a single earner in the US. And then lots of them are in healthcare. I don't probably have to belabor this point, but just some famous examples. Who's this? You can put it in the chat or just call it out. Does anyone recognize this guy? He was famous even when I was in med school. Dr. Sanjay Gupta, correspondent for, I forget, CNN or something. I don't even know. Second, this is Monica Gandhi. She's been more famous recently. She does a lot of, she's been really, really active in the Bay Area as an infectious disease doctor who talks about issues related to COVID and masking and immunization. And then this is, who knows who this is? Somebody will know who this is, right? These are, well, I shouldn't say. This is Vivek Murthy. He's the Surgeon General of the United States, and he was actually Surgeon General once before as well. He's made some very funny videos with Elmo and others. And of course, many of you will recognize that there's tons and tons of physicians that you know in real life that are Indian or that are Hindu specifically, because not all Indians are Hindu, and I just want to emphasize that that's the case. But I would also say that don't assume that your Hindu patients fall into any of these categories either, because there's plenty of Hindus who do other work, and there's plenty of Hindus who are not South Asian who immigrated for other reasons and may be doing all sorts of other things. In general, I would say it's accurate that Hindus speak English very well. It's been very rare for me to encounter patients who only speak like a non-English language, like Hindi. Every so often, I will speak to my patients in Hindi if they also speak Hindi, which is not all of them. I think only 14 or 20% of Indian Hindus speak Hindi in this country. But I think that in general, you should not run into issues, especially because a lot of the people here are the children of immigrants rather than immigrants themselves as well. And of course, English medium school is a very common thing in India as well. Hindus in America are pretty liberal on a range of social issues. So just like, for example, 71% except this is from like several years ago. But this is relatively recent. I think many of you are very young, so you may not remember what things were like in the 80s and 90s, but like people routinely used like anti-gay, lesbian terms as slurs. And this is just a sign that like things have drastically changed for the better, even in my personal life, personal timeline, I should say, like of when I was growing up till now. And Hindus in general are pretty accepting of people who are LGBT. 68% favor same-sex marriage, which again is actually a huge change from even just like 15, 20 years ago for the country as a whole. Evolution, they tend to accept that evolution happened. 68% want abortion to be legal in most or all cases, et cetera, et cetera. These numbers in general are larger than the American average. And one thing I will note is that unfortunately there are not too many Hindu chaplains around for a variety of reasons. But you can at least offer a Bhagavad-Gita if one is available. And there's actually sites you can go to where you can just Google and ask, like, are there, where can I get a Bhagavad-Gita? The patient is asking for one. They want to read about it while they're in the hospital, sick with whatever. Okay, now moving on to the Hindu patient. So we'll talk a little bit about some of these some of these issues. So from a dietary standpoint, as I said before, many Hindus are vegetarian. Not in all cases, definitely not even the majority of cases. As I said, the majority, it's probably accurate to say they don't eat beef, but um, some will adopt certain restrictions, like I don't eat meat on Tuesdays. And being aware of that and having like a culturally relevant diet is a good plan, right? So if your dietitian goes in and starts recommending a lot of lean proteins, just knowing what you can work with. And then the other thing is that obviously the foods are different too. Like it's always very frustrating when you hear dietitians talking about pasta and like whatever the case might be, when what you really want them to be talking about is which kinds of like biryani or whatever might be appropriate to them. Like it's just better to recommend culturally relevant foods, and dietitians can often find resources like that if you just let them know they should. Clothing wise, there's no real big point to make about this other than the fact that there is just a tremendous variety. I was asked to comment specifically on whether you will notice restrictions, like Hindu patients don't want there to be, like a male examiner if they're female or vice versa. But I don't think that there's anything like that in general. If they ask, of course, you can ask, and if they say that they would like to have a certain person examine them, you can sort of see if that's possible to do. But in general, Hindu patients tend to be pretty game. If you say, I know this may be uncomfortable, I'm going to examine you now, I may have to, partially undress you or partially change blah, 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 may have to do a pap smear. I think in general, you'll find that patients will go for that. Clothing wise, there's just a tremendous amount of variety. This is actually a sari, which is like a very traditional Indian outfit that women wear. But you may or may not appreciate this, but it's worn completely differently between Gujaratis and Tamilians, who are two different groups from India. This is a person wearing the pallu, sort of like the part that's free in the front. This is a person who's put these three women have put it in the back, and so it's just a sign of like how much diversity and variety there is and that you would encounter, just like you would expect in any other tradition. So Hinduism has a variety of rites that are observed from birth to death. And so, one of my favorites is that, I was told the story, and I've also done it for my own kids, is when I was born, the first thing my dad did was he wrote the symbol Om on my tongue, with clean hands, of course. And similarly, like I did the same thing for each of my four children as they were, as they were put on the little, uh, the little like incubator thing before they're sort of warmed up and taken to the nursery. This is actually a picture of the Annaprashna, the first presentation of food. And one thing I should just mention, in a medical context, it comes up early in life is circumcision. You can feel free to offer this to your Hindu patients. I wouldn't pressure them for it. For some traditions, circumcision is an important part. It's often done by a religious person, but for Hindus, there's nothing like that. And some of them may not want it. Um, but if you tell them that there's like a medical justification for it, or if you walk through the benefits and risks, I know there's some, um, transmission of certain STDs, etc. But in general, I think that it's not something that you feel like you have to get them to do. Family involvement. This is a Hindu wedding. You can see there's a lot of family there, even in the COVID era, although actually this may not have been the COVID era because I don't see anyone wearing masks. You may see that there's a lot of visitors, and I wouldn't say that's exceptional for Hindus. Like obviously you'll probably notice this for a lot of immigrants, immigrant families. This is a really, really big topic, and I don't think that there's much to say about it that can be said quickly other than this, which is that when you're talking about a Hindu patient and you're talking about Western medicine, the most important thing to think about is are they like, what are you offering and what is the benefit of it? And the benefit of it in general, I think Hindu patients will respond to that more than any specific thing about their tradition. So if you say that you really, really need this to live, then most patients will say that's okay, that's acceptable. And there's been this question like there's a lot of like misinformation that was sort of circulated during the pandemic about how like there was like the parts of a cow were used in the production of the vaccine. But that was in general countered very aggressively by even like a lot of Hindu religious leaders, and in general it didn't change the rates at which Hindus are vaccinated, which I'll talk about in a minute. So in general, I would say most Hindus will go along with your recommendations, or if they don't, the objection will not be a religious one. Uh, Back to coronavirus, probably everyone's least favorite topic by now, but obviously all around us is that I was looking for specific data on vaccination rates. Um, all I found was some stuff by ethnicity. There's some very, very high level stuff about like certain Christian denominations, but I think the rest of us are just kind of a rounding error, so they just group them all together. So it's very hard to tease out specifics. But the Asians in general have a very, very high vaccine dosage rate. I'm I think it's fair to assume that Hindus are a part of this story. They're somewhere in there, is what I mean by that. Not that they're responsible for that high vaccination rate, but that their numbers are not going to be like 60%. They probably also won't be 100%, but they're going to be somewhere in that 80%-ish range because most Hindus in this country are Asian and specifically South Asian. Um, I started this talk with a story about the god of death. And so, one thing I want to mention is that when you reach the end of your life, death is not, he's kind of an interesting character. Here he's pictured again, but in a slightly more positive role than in the earlier story I described him. This is a woman who basically tricked him, and when she tricked him, he was so pleased that he granted her like a variety of sort of religious favors, religious boons. And there's another story of death where it's sort of like this little boy comes to him and he's pleased with him, and that boy asks, like, oh, he says, ask me for anything. And the boy says, I want to know about the life, like, I want to know about eternal life. And he's like, oh boy, that's a lot. I can't tell you about that. And he says, no, that's what I want. And you said you would grant my wish. And he's like, what about money? What about this? What about that? The point is that Death is not considered an evil figure or even a particularly harsh figure. He figures in some very prominent roles in a lot of the stories that we tell as Hindus. And accordingly, it's not something to be sort of like rushed towards or even welcomed, but it's also not something um, to fight with like every last measure of your being either. And so that gets back to the point I was making earlier about interventionism and how you sort of frame it. Okay, I only have two more slides. So the first thing I was going to say is that from a last rites standpoint, um, in general, although not in all cases, Hindus will prefer to cremate their dead. It's a funeral pyre in like the traditional way, but obviously in this country it tends to be electric cremation. And the only thing that you might notice for Hindu patients specifically is they are sometimes surprised or even shocked at how long it takes to get to that point. In India, the cremation happens like within a day. Sometimes people are flying in and they miss it, even like close relatives. But I think in this country, sometimes like 3 days, 4 days, 5 days pass, and that's kind of. But as long as you explain that it sometimes takes longer in this country, I think that you won't notice that that's a huge issue. And then this is a really helpful website. I think if you just Google last rites from Hindu Community Institute, they've sort of presented what some of the key events are, and they've done it along the different axes of what's happening. Even as like a physician, it took me a while to really appreciate that there's what's happening to the family, there's what's happening religiously, there's what's happening medically, there's what's happening regulatorily, and all of that is sort of happening at the same time. And they've given sort of like a time frame of like what it means. And then this just sort of framing belief from the Bhagavad-Gita again, that the self can never be cut into pieces by any weapon, nor burned by fire, nor moistened by water, nor withered by the wind. So this is a really important piece and a source of a lot of comfort to a lot of Hindu patients. And I think that when we talk about the self, that's sometimes used synonymously with soul. So this is my wrap up, which is that Hinduism is a very pluralistic, varied religion that's really focused on the pursuit of happiness at all the levels I talked about. And one of those levels is the sort of eternal, like, why are we here type of questions. And, Hindus in general in this country that you encounter will be a small, highly educated, wealthy community. Not in all cases that you could asterisk that for everything. You have to ask your patients individually. And Hindu patients will, in many respects, resemble other immigrant patients. And some of the specific things I told you, like don't try to put their feet on books. Try to sort of always ask them about what their beliefs are, if that's important to the specific situation that you're in. And good luck. I hope that this has been helpful, and like I'm happy to take questions now and also offline.
Yeah, if anybody has any questions at this point, just please feel free to unmute yourself and ask. Seeing a bunch of thank yous in the chat section.
I have a question I can ask. So I
Yeah.
guess, yeah, have you noticed that a lot of Hindu patients come to you because you are Hindu, or you know so much about the Hindu religion that they feel like they can relate?
That's a great question. So I'm a hospitalist. So people who come to me, it's kind of the luck or unluck of the draw, as you might guess. So like, we are on a call schedule, and if a patient gets admitted and, I happen to be on call that day, then they'll come to me. So I actually don't have much control, and they don't have much control over who the patient goes to. Um, so yeah, unfortunately or fortunately, not really in my case. But that might not be true in the cases of like people who have clinic, for example.
I have a question. So,
Yeah.
in order to best assist Hindu patients, how well do we have to know the Ayurveda medications you talked about?
I don't think you have to know much. I think as long as you kind of ask them, then you can go and Google it. I mean, that's what I do. I think that's what most people do. I don't think you have to know much about Ayurveda. You just have to know that they are taking something, and that can be the basis in which you go and inquire further. uh, you'll find that you do a lot of PubMeding and a lot of Googling as a practicing physician. Hopefully that's reassuring because,
Mhm.
all the things you're learning now, you won't remember all of them, but the ones that you encounter a lot, you'll remember.
And would it be disrespectful to like suggest substitution with more evidence-based medicine?
Yeah, I think that in general, the way to do it is like in that very culturally uh, respectful way. So like you say, oh, I see that you're taking this. I'm worried based on what I've read that it could interact with these medicines. And then it's like a negotiation, right? Like you could say, I was wondering if you could hold this for the next few weeks to see if we can get a better response from your cholesterol lowering medicines or your blood thinners or whatever the case might be. I think you'll find that many, many patients are amenable to that. If you don't feel like, if you're coming out like swinging like, stop taking these stupid medicines, like that's probably not going to work, right? But that's probably something you already knew without me telling you that. So I think as long as you're very respectful about the way you approach it and thoughtful about the way that you sort of interact, you'll find that it's actually pretty easy in most cases to get patients to stop taking meds that you're worried might be hurting them.
All right, thank you.
You bet.
I actually
Any other
had one more.
questions? Sorry, go ahead.
Yeah, I had one more question actually. I think someone asked us before this began. And I'm not sure, maybe you may not be able to answer it, but since you spoke about how many Hindus are vegetarian and the ones who are not abstain from eating beef, how to correlate with the patient who might need a bovine or a porcine derived surgical implant?
Yeah, that's a great question. I think that the way that I would approach that is first of all see if there are alternatives. So if it's like not everything that's bovine has only bovine alternatives, right? Like you might we talked about bovine valves or porcine valves or whatever. I think for health reasons, most of the time that's not going to be an issue. If you say, I'm sorry, this is the only alternative that we have, um, and then they'll kind of talk it over, and I think in general that won't be an issue. For some it might be because, like I said, there's no way to generalize, but I would just approach it honestly and with like clear interest in why they are concerned about it.
That was the question that I had too, Anushri. Thank
Yeah.
you for asking. Yeah, I was really wondering about that.
Yeah.
Um, Anybody here have any other last minute questions?
Oh, I guess I had one more too. I mean, sort of on that, really, not maybe a different note, but I know you didn't mention it, but I know a lot of patients who follow Hinduism also fast a lot depending on the occasion. So
Hmm.
how does that relate whenever you treat patients who are high risk who want to still follow that um, practice of fasting?
Yeah, this is going to be a little bit of a broken record answer to what is an excellent question, but I think it will be the same thing where you can say, um, obviously, like you don't have to ask everyone if they are fasting or if they're thinking about fasting. Like I know that it's the case for some Hindus, but you can ask if they tell you that they're fasting or tell you that they are um, abstaining from certain meat or whatever the case might be, that you would just say, I know that this is something that that you're doing right now. I think it's great. In this specific case, it would be, it feels like it might be harmful if you do that now. Is it possible that you could do that another time? And I think that that's something you'll find in most religions. I think, like for example, if I've understood Islam correctly as well, I've had patients in this situation where they're fasting during Ramadan. But if you're sick, I think you're not obligated, right, to
Mm.
fast. And
Yep.
so that's true in Hinduism. That's true in most traditions, I would say, is that there's always a carve out for those sorts of situations.
Um, I wish we had more time for these sessions because they're just like I learned so much. We all learned so much from this. It's just like the how tight the schedules are, and
Yeah,
like
no
everything
problem.
is
No, I
rushed.
I get it. So like I said, if there's other questions, you have my email. Feel free to reach out. But it's been a pleasure being with you all today, and do keep me posted.
I had just one like
Oh,
large overarching question before we end it
sure.
off. Um, just like taking everything that you've given us into consideration, as medical students and as future physicians, for a lot of us who didn't know about, this and don't have this information just from the outside looking in, like what can we do to, just like work on our cultural competency and, like relate to our patient on a different level, just from, relate to people that are coming from these different backgrounds, just as outsiders, not knowing all of this about them.
That's such a great question. It's so insightful. And I would say that I guess my closing thoughts as a physician at this point is number one, just always keep your ears open. Like you'll notice things that really make the practice of medicine very, very fun if you notice like that patients are doing certain things. Um, And then second, if you just approach it from a position of cultural humility where people say, "Oh, I can't do this or I can't do that," the very natural reaction is to sort of react with exasperation, like, "Oh, another thing to deal with." But if you say, "Oh, that's interesting. Tell me about that," I think you'll find that life is very, very different from Twitter, right? Like on Twitter, people just explode, like, "I shouldn't have to educate you," and blah, blah, blah. But in real life, people are very appreciative if you just say, "Oh, I didn't know about that. Can you tell me a little bit more about that? I would like to understand a little bit about what this means to you." People really respond to that, especially when they're vulnerable and sick. I think it helps build a relationship like you wouldn't believe.
Thank you.
Yeah, my pleasure.
This was
All
super
right.
informative. Like I can't thank you enough for joining us and for agreeing to be with us and doing this with us. It was such a pleasure to have you here.
Well, thank you so much. And like I said, the pleasure was all mine. All right. I'll see you all later.
Thank you, Dr.
Thank
Khanna.
you. Thank you.